Good afternoon, everyone. Good afternoon. Welcome back again to our men and mentoring recovery support group. This is another segment brought to you by an article that we chose to uh, talk about, speak on. Once again, my name is Craig. I am a recovery coach. I'm someone who also is in recovery. And just for a reminder, May is Mental Health Awareness Month. And so we're going to be talking a little about mental health as well as addiction. All right. And so this article is brought to us today by honeyridgerecovery.com. Okay. Once again, if you would like to retrieve this article for yourself in its whole entirety, you can go to honeyridgerecovery.com. All right, without further ado, today's topic is how trauma shapes addiction and healing. All right, we're going to be talking about how trauma shapes addiction and healing. Once again, this is our mentoring support group. And without further ado, let's get right into it. So, the synopsis of this article says trauma can significantly impact an individual's life, influencing their thoughts, emotions, and behaviors. According to experts at drug and alcohol rehab, it is increasingly recognized that trauma plays a substantial role in the development of addiction. People who experience trauma often turn to substances or addictive behaviors as a means of coping. This article explores the intricate relationship between trauma and addiction, common coping mechanisms associated with trauma, how trauma shapes addiction, and the road to healing, and the importance of supportive relationships in the healing process. All right. So that is the introduction of this article. But one of the discussion that we're going to, one of the topics we're going to share is ways trauma shapes addiction and healing. So the article says traumatic experiences can significantly contribute to the development of addiction in several ways. Trauma, whether it stems from childhood abuse, violence, accidents, or other distressing events, can deeply impact an individual's psychological and emotional well-being. Trauma and addiction often coexist, and individuals who have experienced trauma may adopt specific coping mechanisms and patterns to deal with their distress. These coping mechanisms can be both adaptive and maladaptive in nature. All right. And so these coping mechanisms can be brought on or incorporated through a lot of hosts of things, whether it be external or internal, right? So the article says some ways in which trauma shapes addiction and healing include, we have 8 of them, right? We're talking about some ways in which trauma shapes addiction and healing. And they are, number 1, the need for self-medicating. 2, numbing and avoidance. 3, emotional regulation. 4, coping mechanism. 5, disassociation. 6, co-occurring mental health illnesses. 7, neurobiological changes. And 8, risky behaviors and self-harm. All right. And these are some ways in which trauma shapes addiction and healing. All right. And so the article goes on further to say understanding these patterns is essential to providing appropriate treatment and support for individuals struggling with trauma and addiction. All right. It is important to address the underlying trauma and develop healthier coping strategies to break the cycle of addiction and promote long-term healing. All right. So now we have to find some healthy coping strategies to break the cycle of addiction. And so one of the common ways that this is brought on addiction, one coping mechanism that one utilize is that is people oftentimes self-medicate. Self-medication. Trauma survivors often experience intense emotional pain, anxiety, depression, and a sense of helplessness. To cope with these distressing feelings, they may turn to substances such as drugs or alcohol as a way to self medicate and temporarily escape their emotional turmoil. Substance use provides temporary relief from the overwhelming emotions associated with trauma. A lot of times, people may not understand or realize that their alcohol or drug addiction is rooted in something greater than just wanting to experiment with alcohol or drugs. There have to be something deeper. And so one of the things that researchers have found out that most people who uh, chose to cope with life stresses or situations from the abuse of or the event of trauma, they self-medicate, right? Begin to numb themselves. We're gonna get into numbing. I believe that's the next one. But people self-medicate to mask, try to mask the pain and hurt that they're feeling. And so let's go on to the next one, and that is we're talking about ways in which trauma shapes addiction. All right. But the title is How Trauma Shapes Addiction and Healing. All right. And so we just went over self medication. Another way people uh, deal with hurt, pain, anxiety, depression, they began to numbing, avoidance, and isolation. All right. Self medication is the first one. This one talks about numbing, avoidance, and isolation. Trauma survivors may engage in addictive behaviors to numb their emotional pain or avoid distressing memories and triggers. By using substances or engaging in addictive behaviors, patients at drug rehab centers report they have tried to create a temporary buffer that helps them dissociate from the traumatic experiences and the associated emotions, right? So a lot of times, uh, us that went through trauma, a lot of times, I know I have done it when I try to deal with uncomfortable situation or maybe hurt and pain, not being able to cope with it adequately. So I use alcohol and drug as an outlet to try to escape what I actually was feeling or not being able to express intellectually how I was feeling because I wasn't able to really understand that I needed to identify exactly how I was feeling and to perceive how I was feeling in an appropriate manner. All right. So this article goes on to say trauma survivors often employ isolation as a coping strategy. They may avoid triggers, people, or situations that remind them of the traumatic event. By isolating themselves, they attempt to create a sense of safety and minimize the risk of re-traumatization. We often talk a lot of times in rehab, people, places, and things try to not associate ourselves with past experience or those who are still in the throes of addiction if we're not strong enough to say no. So this part of numbing, avoidance, and isolation makes light of why people uh, avoid certain people to create a sense of safety. Trauma survivors at rehabs for veterans often develop emotional numbness as a way to protect themselves from further pain. They may disconnect from their emotions to avoid feeling the intense distress associated with trauma. Substance abuse or addictive behaviors can exacerbate emotional numbness by further blunting emotional experiences. Now, this is really not too high level, but it's just something that we need to talk about, especially when we're talking about mentoring someone or coaching someone or being a role model or being in leadership. We need to let people know about some of these topics that we're talking about: self-medicating, numbing, avoidance, and isolation. And so the next one we want to talk about, which is also important, and that is emotional regulation. Trauma can disrupt an individual's ability to regulate their emotions effectively. Substance use or addictive behaviors may be used as a way to modulate and regulate intense emotions that arise from the trauma. Drugs or addictive behaviors can provide a temporal sense of control over emotions, right? So you may have some people say, "Oh, let me smoke a cigarette to calm my nerves," or "Let me have a drink so that I can relax," or "Oh, let me have a drug so that I can just mellow out." Or, they used to have a term when I was in my, I don't know if they still use it. When I was in my active addiction, we used to say, "Let me take a chill pill," and we thought that was something fancy or fly to say, just to escape from how we actually really feeling in an unhealthy behavior. And so we need to address those terminology and change it around with something positive. All right, and don't just take it lightly as something fly, something cool to say, just to try to sound part of the in crowd. So if you can hear, I'm trying to, talk, but I'm using different phrase or different interpretation as to show growth and development. So that's why if you hear me and you know me from how I would normally talk around certain crowd of people, I no longer try to utilize that because we have to be professional. We have to grow up and we have to be mature. And that's all part of being a mentor, being responsible, being reliable, being dedicated, being respectful, and so being honest. We need to have all those good attributes. All right. Let's go on and talk a little more about emotional regulation. Drugs or addictive behaviors can provide a temporal sense of control over emotions. Let me read that again. That's very key. Drugs or addictive behaviors can provide a temporary sense of control over emotions, albeit a dysfunctional and short-lived one. As found in patients at alcohol rehab centers, similar to those who suffer from drug addiction. All right. And so it's only a temporary fix to a long-term wound that need to be healed properly and appropriately through professional help. We always stress on this segment or any other segment the importance of seeking professional help, especially when it comes to alcohol and drug addiction. Okay? Let's talk about another aspect that we want to cover today, and that is coping mechanisms. Trauma survivors may develop maladaptive coping mechanism. That word maladaptive, if I'm defining it right from the Webster Dictionary or the Google Dictionary, which is often used nowadays. I know in my days it was Webster. So the Google Dictionary, maladaptive is an unhealthy adaptive style of coping with alcohol and drugs. So this article says trauma survivors may develop maladaptive coping mechanism as a result of their experience. or Chat GPT, whatever search engine that you use, large language model, if that's what you're using, kudos. All right, these coping mechanisms can include substance abuse, all right, compulsive behaviors, or other addictive patterns. The addictive behaviors serve as a coping strategy to deal with the ongoing distress and the long-term effects of the trauma. All right, and so maladaptive behaviors in order that people use to cope with situations. That's why it's so important to have mentors in our lives. It's very important to have positive role models, positive mentors, people who are going to tell us what we need to know, especially when we're going down the wrong path. And so uh, I believe that, especially for young men and men in the developmental stage, and if they're confronted with life and situations and circumstances, we may need to bounce ideas or situations off one another to get healthy feedback. And that's key. All right. So, coping mechanism. All right. Coping in an adaptive uh, mechanism to deal with problems or situations that may occur. Let's talk about another one. That is, all of these are great topics, great discussion. And this one, once again, we're talking about or making notice of that May is mental health awareness. So we're talking about dual diagnosis, co-occurring alcohol or substance abuse and mental health. And so this one we want to share with you, and that is disassociation. Disassociation is a defense mechanism commonly observed in trauma survivors. It involves detaching oneself from the present moment or associating from the traumatic memory and emotions associated with the trauma. Some individuals may disassociate through substance use or engage in addictive behaviors to escape from reality. All right. And so this article says that is a defense mechanism. Don't want to deal with it, can't deal with it, don't, and don't want to talk about it. So people may put up a wall, may put up a shield, and that's their way of dealing with issues in life. And so if you're able to find a technique or model that can break through with that person or individual, if you know someone who has disassociation behaviors, uh, let's understand what they're dealing with. Now you may have a better insight of why they are so defensive, because they may have suffered from so much trauma. Yes, we're talking about trauma because we need to talk about it more and more, I believe, because a lot of times mental health get a bad light. A lot of times people want to shy away from it. It's looked upon as taboo. So a lot of times people have this misconception, stereotypes, and labeling. And so we want to dispel all of these myths, and that people who have mental health issues or substance abuse issues can get healthy with the right, appropriate professional help. All right, let's move on to the next aspect. And I made mention of uh, this topic, and that is co-occurring mental health disorders. All right, trauma often leads to the development of co-occurring mental health disorders, such as post-traumatic stress disorder, better known as PTSD, anxiety, or depression. These mental health issues can increase the risk of developing addiction, as individuals may turn to substances or addictive behaviors as a way to manage the symptoms of these disorders. All right. So if you know someone who's been through a traumatic ordeal where it caused a lot of stress and strain, anxiety, fear, and depression, a lot of times uh, they may not really understand it. They may not understand that they are been a victim of it. Or been connected to it some type of way. Well, this article makes mention sometimes people without professional help take on substance abuse issues to try to handle or cope. So we need to shed more light on PTSD. I remember talking to a veteran, and that's how I got really more involved or very a clear understanding uh, co-occurring when it comes to the aspect of substance abuse and mental health. Not only through reading books, but I spoke to this gentleman and I was doing a re-entry, and this guy, he just came home from incarceration. He was part of the federal institution, whatever they call it. But he was incarcerated, and he did a lot of times, many years. He did a lot of years, and he told me that he was in the United States Armed Forces prior to going to prison. And he said, and I asked him, I said, well, how did you get mixed up with the criminal justice system? And then he explained to me that he is a victim of the Vietnam War and that he had seen so much devastation and that the Agent Orange, the chemicals that they had to breathe during that era of war did something to his brains, and so he developed PTSD and a whole host of other stuff. And so it just made me just think and ponder like, wow, here's a guy who fought for the United States of America, and he was subjected, unfortunately, to what he was subjected to, and he committed a crime, and he did a lot of time for the crime he did. And it just made me think that, a lot of people that's on alcohol and drugs, or who are going through so much turmoil in their life, that is, if there is a deep root cause why they are so entrenched in the alcohol and drug, because number one, they probably never been diagnosed that they have a mental health issue. They probably just thinking that they just have a simple alcohol and drug addiction. Probably say, I just can't fight it because they've never been treated appropriately. And so if you know someone who's struggling with alcohol and drugs, there may be, we're not saying every person that's on alcohol and drug abuse or addicted to alcohol and drugs or that has mental health issues as well, but there may be a vast majority of people who may have co-occurring issues. All right, let's move on. All right. The next one we want to talk about, and that is neurobiological changes. All right, neurobiological changes. The article says trauma can have a profound impact on the brain, leading to changes in neural circuitry and neurotransmitter functioning. These changes can affect reward pathways, impulse control, and decision-making process, making an individual more susceptible to addictive behaviors. It is important to note that not all trauma survivors develop addiction, which can involve multiple factors, including genetic predisposition, environmental influences, and individual resilience. However, trauma can be a significant contributing factor in the development of addiction for many individuals. Let me read that again. It says, however, trauma can be a significant contributing factor in the development of addiction for many individuals. Understanding the relationship between trauma and addiction is crucial for providing effective substance abuse treatment and support for individuals struggling with both issues. All right, let's go on. This is some good information that need to be shared. All right, and so the next part we want to talk about risky behaviors and self-harm. The article says trauma survivors may engage in high-risk behaviors such as reckless driving. Talking about risky behaviors and self-harm. Once again, the article says trauma survivors may engage in high-risk behavior such as reckless driving, promiscuity, or thrill-seeking activities. These behaviors serve as a way to distract from or cope with underlying emotional pain and distress. Risk-taking can temporarily provide a sense of control or an adrenaline rush, offering an escape from the trauma, right? And so I remember when I was in the therapeutic community, the supervisor who was the counselor of all the counselor and the program that I was part of, there was people in there who said, I ain't no dope fiend. I'm not like them. I'm not like, I only smoke marijuana when they sniff heroin, and this one, he smoked crack, And so the supervisor says, well, what makes you so different from the next person? Because when it's all boiled down to it, it's no matter how you consumed it or what you consume, you still consume drugs. And he goes on to say that, so you have one guy, he would say, well, I didn't get high, I didn't smoke reefer, I didn't drink alcohol, I didn't do nothing. I didn't sniff cocaine, crack cocaine, heroin, never shot stuck a needle in my arm, none of that stuff, right? And so he says, okay, you said that to say what? He said, well, I don't know why I'm in this program. He says, well, addictive behavior comes in many forms. Now, you say you was someone who was distributing illegal substances in the community or selling dope in the community. He says, well, your addiction was that you was adrenaline that what made you want to pursue the behavior in which you pursued. And that brought me to this when it was talking about risk behavior and self-harm. A lot of times people don't realize that the adrenaline rush, can be a form of hiding from trauma to avoid what they're dealing with. And it may seem simple, but that is so true because a lot of times people are just chasing money, running after money or relationship issues or whatever can be adrenaline. Another thing the counselor told me, he says, let me let you know something. Everything in life is a behavior. I never forgot that. Mr. Skirty, who was one of the supervisors who taught me that, he said, let me tell you something, Craig. Everything in life is a behavior. Now, whether it's a good behavior or bad behavior, there is a behavior. All right. And so you take the word from the wise and You may want to remix it, however, but everything in life is a behavior. Let's move on because we're talking about risky behaviors and self-harm. Some trauma survivors may also resort to self-harming behaviors, such as cutting or burning themselves as a maladaptive coping mechanism. Self-harm may be an attempt to regain control, express emotional pain, or temporarily distract themselves from overwhelming emotions. Man, we went over some really great topic, and let's I want to go back over the the these 8 topics, and the first one talks about, because we're talking about how trauma shapes addiction and healing. All right. So the first one we covered was self-medication. Second one was numbing, avoidance, and isolation. Third one was emotional regulation. Fourth one, coping mechanism. Sixth one, disassociation. Uh, I believe 7, we talked about co-occurring mental health disorder. I hope I'm reading them all in numerology, numeral order. All right, let me say that. Neurobiological changes. All right, and we just talked about risky behaviors and self-harm. The next one we want to get right into, and that is negative consequences and perpetuation of the trauma and addiction cycle. And this is something the article touches on. It says the trauma addiction cycle can create a vicious cycle where addiction worsens the trauma symptoms, and in turn, the trauma triggers further substance abuse. This cycle can lead to deteriorating physical and mental health, strained relationships, financial difficulties, legal issues, and a decreased quality of life. It is crucial to address trauma and addiction to break this cycle simultaneously. All right? And so the last one, but not least, and that is identifying signs and symptoms of trauma. Identifying signs and symptoms of trauma. Identifying signs and symptoms of trauma is crucial for early recognition and intervention. Trauma can have a profound impact on an individual's mental, emotional, and physical well-being. While the signs and symptoms may vary from person to person, here are some common indicators to look out for. Number 1, emotional symptoms: intense fear, anxiety, panic attacks, frequent mood swings, feelings of sadness, hopelessness, depression, emotional numbing, or detachment. Number 2, cognitive symptoms: difficult concentrating, memory problems, intrusive thoughts about the traumatic event, distorted perception, or disassociation from reality, etc. Third, physical symptoms: insomnia, nightmares, fatigue, low energy levels, chronic pain, headaches, migraines, weakened immune system, frequent illnesses, etc. It is important, read that now. It's important to note that everyone may not exhibit all of these symptoms, and their intensity can vary. The presence of these signs and symptoms for an extended period, typically more than a month following a traumatic event, may indicate the need for professional support and intervention. If you or someone you know is experiencing these symptoms, reaching out to a mental health professional who can provide a comprehensive assessment and appropriate treatment is essential. Remember, early recognition and intervention can significantly contribute to the way trauma shapes addiction and the road to healing. I hope the information that was shared today shines some light on the importance of while we do what we do here at Capital Recovery Center by bringing you information in the hopes of preventing and intervening uh, and getting people healthy and well, whether it be from the substance abuse issue or from the co-occurring issue within itself. Remember, May is Mental Health Awareness Month. Be mindful of those you come in contact with. Let's try to be more kind, respectful. Let our humanity supersede our ego. Okay? And humble. So let us try to be more humble and respectful to one another. Until the next time, my name is Craig. Take care of yourself. Stay safe. I'll see you on the next one.